Bismillahirrahmanirrahim. The quote of the day is tears of joy are like the summer rain, draws spirits by the sunbeams. Today the topic of presentation is Onchocerciasis, the river blindness under the kind supervision of Professor Dr. Saira Afzal. The learning objectives of today's presentation is that by the end of this presentation, participants will be able to describe global burden, geographical distribution, epidemiological triad, clinical manifestations, diagnosis, prevention, and control of onchocerciasis. Case history. A 40-year-old person from Sudan lives near a river with a high density of black flies, has a blindness and a leopard skin appearance with on and off itching. Introduction. Onchocerciasis, commonly known as river blindness, is caused by a parasitic worm, Onchocerca volvulus. It is transmitted to humans through the exposure to repeated bites of infected biflies of the genus Simidium. Symptoms include severe itching, disfiguring skin conditions, and visual impairment, including permanent blindness. Problem statement. More than 99% of infected people live in 31 African countries. The disease also exists in some foci in two countries in Latin America, that is Brazil and Venezuela, and it is also found in Yemen. The global burden of disease study estimated that in 2017 there were at least 21 million people infected with onchocerciasis, of which 14.6 million had skin diseases and 1.5 million had visual loss. Now this is the map of the geographical distribution of the onchocerciasis. The portions of the world in red have the countries who are endemic with onchocerciasis, that are in Africa, one country from Asia, that is Yemen, and two in the Latin America, that are the Venezuela and Brazil. And these four in light green portions have those countries which have declared by WHO as those who have eliminated the onchocerciasis. These are the Mexico and Colombia. Now, who are people at risk of onchocerciasis? The people most at risk for acquiring onchocerciasis are those who live or work near streams or rivers where there are Simoleum black flies. Most of the areas where the black flies are found are rural agriculture areas in sub-Saharan Africa in the countries mentioned previously. Usually many bites are needed before becoming infected. Therefore, those travelers to at-risk areas most likely to become infected are long-term missionaries, Peace Corps volunteers, field researchers, and long-term travelers. Now the epidemiological triad of onchocerciasis. The agent is Onchocerca volvulus, that is a nematode roundworm. It is a parasite. The host is the human beings, and the environmental factors that contribute to the disease are uh, where the black flies density are more in near the rivers or the streams, and the vector is a black fly that belongs to a Smolium genus. Now the life cycle of the onchocerciasis. First step is the black fly takes blood meal, passing the larval L3 stage into the human host blood. The larva migrate to the subcutaneous tissue and undergo two more molds. They form nodules as they mature into adult worms over 12 to 18 months. After maturing, adult male worm mate with the female worm in subcutaneous tissue to produce between 700 to 1500 microflora per day for 10 to 15 years. The adult worm lives in the human body for about 10 to 15 years. Microflora lifespan has 12 to 15 months, and it is detectable in the skin 12 to 18 months after the initial infection. The microflora migrate to the skin during the day, and the black fly is only fed in the day. So the parasite is in a prime position from the female fly to ingest it. Black flies take blood meals to ingest these microflora to start the cycle. A civilian female black fly takes a blood meal on an infected human host and ingests microflora. The microflora enter the gut and thoracic flight muscles of the black fly, progressing into the first larval stage. The larva mature into the second larval stage and move to the proboscis and into the saliva in its third larval stage. And after maturation takes place about 7 days, that it becomes infected after the 7 days in the black fly. Now, this is a diagrammatic illustration of the life cycle of Onchocerciasis. The first step is when black fly of the genus Milium takes a blood meal and it incorporates a third larval stage into the human blood, and then the larva goes into the subcutaneous tissue where it becomes adult in 12 to 18 months, and after this the mating occurs, and after mating it produces numerous microflora per day, about 1500 microflora per day for 10 to 15 years, and then in the day it migrates to the skin. When black fly takes a blood meal, it also ingests microflora. Then the microflora travels into the thoracic muscle, from the gut into the thoracic muscles, and it undergoes its transition from larval one stage to second to third, and then it migrates to the proboscis. And when it bites again a human being, it incorporates this larva third stage into the human being, and the cycle starts again. Know the disease mechanism. How the disease develops. Adult worm remains in the subcutaneous nodule, limiting access to the host immune system. Microflora, in contrast, are able to induce intense inflammatory response, especially upon their death. Wolbachia species, that is a bacteria, have been found to be endosymbionts of Onchocercia volvulus adults and microflora, and are thought to be the driving force behind most of the Onchocercia volvulus morbidity. Dying microflora have been recently discovered to release Wolbachia surface protein that activates toll-like receptors 2 and 4, triggering innate immune response and producing the inflammation and its associated morbidity. The severity of illness is directly proportional to the number of infected microflora and the power of the resultant inflammatory response. Now the signs and symptoms of the disease. Skin involvement typically consists of intense itching, swelling, and inflammation. A grading system has been developed to categorize the degree of skin involvement. The first stage is the acute papular oncodermatitis. That is a scattered purpuric papules, as seen in the first figure, that these are the scattered papules of the skin. Then the second stage is the chronic papular oncodermatitis. These are the larger papules resulting in hyperpigmentation. Then the third stage is the Likenified oncodermatitis. This is the hyperpigmented papules and plaques with edema, lymphadenopathy, pruritus, and common secondary bacterial infections. As this is shown in the figure, this is the lichenification occurs on the skin, in which there is skin thickening and the prominence of the skin folds. Then the fourth stage is the skin atrophy, in which there is loss of elasticity and the skin resembles the tissue paper or the lizard skin appearance, as this is the skin of the lizard, and in humans it also resembles like the lizard. Then there is depigmentation, and there is a leopard skin appearance, usually on the anterior lower leg, as this is shown. This is the leopard skin, and in onchocerciasis it also resembles like a leopard due to depigmentation. Then it causes thinning of the skin with loss of elasticity that gives the skin a cigarette paper appearance. Like a thin paper of a cigarette, it resembles a cigarette paper appearance. And then it may contribute to the hanging groin. Due to the thin skin, it may hang from the groins. Now the eye manifestations of the onchocerciasis. The inflammation caused by the larvae that die in the eye results initially in the reversible lesions on the cornea that without treatment progresses to the permanent clouding of the cornea, resulting in blindness. There can also be inflammation of the optic nerve, resulting in vision loss, particularly peripheral vision, and eventually blindness. And there is also the glaucoma effect, in which there is the eyes malfunction, begin to see shadows or nothing. Now the diagnosis of onchocerciasis. The diagnosis can be made by the Snip biopsy, that is the gold standard test, or the slit lamp examination of the cornea for visual involvement, and the antibody test or the examination of the removed nodule. The diagnosis of onchocerciasis can be difficult in light infections, which are more common in persons who have traveled to but are not residents of affected area. There are multiple ways that can diagnose. First one is the skin snip biopsy, that is the gold standard test for diagnosis, in which 1 to 2 milligram shaving or biopsy of the skin is done to identify larvae. It is seen under a microscope when shaving or biopsy is put in the physiological solutions like normal slime. Typically, 6 snips are taken from different areas of the body. PCR of the skin snip can allow for diagnosis if the larvae are not visualized under the microscope. In a patient with nodules in the skin, the nodule can be surgically removed and examined for adult worms. Like this nodule is surgically removed and then examined for the adult worms. Infections in the eye can be diagnosed with a slit-like examination on the anterior part of the eye, where the larva or the lesions they cause are visible. Like in this picture, the larva in the eye can be shown in the corneal part. Then the antibody tests have been developed to test for infection, though they are not widely available. They are only confined to the research laboratories. These tests cannot distinguish between the past and current infections, so they are not useful in the people who lived in the areas where the parasite exists, but they are useful in visitor to these areas. Some of the tests are general tests for infection with any filarial parasite, and some of them are specific for the onchocerciasis. So the treatment for onchocercia volvulus. There are two treatment strategies. First one is to kill microflora, and the second is to kill the macroflora, that the adult worm. Microflora is the larva form, and macroflora is the adult form. To kill microflora, 150 microgram per kg orally in one dose is given every 6 months. And to kill macroflora, doxycycline is given at a dose of 200 mg orally daily for 6 months. It kills the adult worms by killing the Wolbachia bacteria, on which the adult worms depend in order to survive. When Wolbachia bacteria have been died by doxycycline, then ultimately the adult worm will also die. Treatment with ivermectin should be given 1 week prior to treatment with doxycycline in order to provide symptom relief to the patient, and for the lifespan of the adult worm, that is for 10 to 15 years, or for as far as long as the infected person has the evidence of skin or eye infestation. Ivermectin is given every 6 monthly, uh, when as long as when the person has a skin or eye manifestations, or for the entire lifespan of the adult worm that has about 10 to that live in the human body for 10 to 15 years. So ivermectin is given for 10 to 15 years every 6 months. No prevention and control. There are no vaccines or medications available to prevent becoming infected with Onchocerciasis volvulus. The best prevention efforts include personal protection measures against biting insects. This includes wearing insect repellent such as DEET on exposed skin, wearing long sleeves and long pants during the day when black flies bite, and wearing the permethrin treated clothing. No mass drug administration. Population-based treatment with ivermectin, also known as mass drug administration, is the current core strategy to eliminate onchocerciasis. With the minimum requirement of 80% therapeutic coverage, at last, at least 12 to 15 years of annual treatment are required in hyper and mesoendemic areas to eliminate transmission corresponding to the lifespan of the adult Onchocerca volvulus. Onchocerciasis Control Program. Between 1974 and 2002, onchocerciasis was brought under control in West Africa through the work of the Onchocerciasis Control Program, using mainly the spray of the insecticides against black fly larvae by helicopters and airplanes. This was supplemented by large-scale distribution of ivermectin since 1989. The elimination of human onchocerciasis would make a significant contribution to the attainment of Sustainable Development Goal, that is 3.3, which includes a call to end all the epidemic of neglected tropical disease by 2030. In 2016, expanded special project for the elimination of neglected tropical diseases in Africa was set up to cover the 5 preventive chemotherapy neglected tropical diseases with 4 core objectives: to scale up treatment toward the achievement of 100% geographic coverage, to scale down or stopping treatments once the transmission has been interrupted or control achieved, or strengthen the information systems for evidence-based action, and improve the effective use of donated medicines through the enhanced supply chain management. With the support of uh, expanded special project of elimination of neglected tropical disease in Africa, Ivermectin treatments continue to scale up, reaching 152.9 million people in 2019, but due to COVID-19 disruptions, the number of people treated declined by 27% in 2020. No certifying the elimination of onchocerciasis. Certification of onchocerciasis elimination is the official recognition by WHO of a country's onchocerciasis transmission-free status. By 2016, four countries have been verified by WHO as having interrupted transmission, that is Colombia in 2013, Ecuador in 2014, Mexico in 2015, and Guatemala in 2016. Now this is the summary of the life cycle of the river blindness. Again, first step is an infected black fly starts the cycle. A black fly deposits larva on the skin while biting, and the larva enter the wound. Inside the skin tissue, larvae develop into worms with cluster density in adult. Adult worms may produce microflora. A female worm can produce almost 1000 microflora per day. Thousands of microflora migrate through the skin tissue, causing a variety of symptoms. Symptoms include leopard skin appearance, acute Likenified skin appearance, lizard skin appearance, and loose growing and other eye manifestations. Then a black fly feeding on the blood of the infected person ingests microflora and becomes infected. And then inside a black fly mid-gut, microflora develop into L3 infectious larva, and then larva migrate from the gut to the black fly progresses. And infected black fly seeks a blood from meal from the host and introduces the microflora into the human host, and the cycle starts again. Now the time for the recent update. First article is development of a recombinant vaccine against human onchocerciasis. Models used to study immunity to Onchocerca include natural infection of cattle with Onchocerca uh, okengi and Onchocerca volvulus, infected third stage larvae implanted within diffusion chambers in mice. A vaccine comprised of two adjuvanted recombinant antigens induce protective immunity in genetically diverse mice, suggesting that it will function similarly in diverse human populations. These antigens were recognized by immune humans and also induce protective immunity against Brugia mali. We describe the development of a fusion protein composed of two vaccine antigens with the plan to test the vaccine in cause and non-human primates as a prelude to initiation of phase 1 clinical trials. The, adjum- the, the adjuvanted Onchocerca volvulus vaccine composed of two antigens, OV103 and OVREL2, was shown to be consistently effective at including protective immunity using multiple immune mechanisms. The vaccine is ready for further evaluation in other animal models before moving to clinical trial in humans. The second article is slash and clear, a community-based vector control method to reduce onchocerciasis transmission by Simulium uh, cerbinum in Maradi, South Sudan, a prospective study. High ongoing Onchocerca volvulus transmission was recently documented in Maradi County, South Sudan. To complement community-directed treatment with ivermectin as the main onchocerciasis control strategy, we initiated a community-based vector control method that is a slash and clear at the Meridi Dam, a Simulium damnosum SI breeding site to reduce Onchocerca volvulus transmission. The method is that Simulium biting rates were collected before and during the 20 months following the slash and clear intervention using the human landing catches. Black flies were dissected to measure parity rates before and 12 months after the intervention. Larvae and pupae of uh, Simulium were collected from the dam for the morphological and chromosomal characterization to identify the cytospecies involved. The results shows that biting rates of Simulium close to Meredi Dam spillway decreased by greater than 90% post slash and clear for more than 6 months, and after 12 months in slash and clear intervention, the reduction in biting rates was still less than 50%. Parity reduced from 30% from pre slash and clear to 5.6% post slash and clear. Larvae collected from the dam were identified as Simulium cerbinum. The conclusion is that the slash and clear method was found to be an effective and cheap community-based method to reduce the black fly biting rates caused by the Simulium. When repeated at least annually together with the high uh, ivermectin coverage. This intervention has the potential to considerably accelerate the onchocerciasis elimination. Slash and clear method is that the garbage of the dam or the spillage are removed. Know the time for the MCQ session. First MCQ is, among many of the infectious diseases causing blindness, trachoma is ranked first among the leading infectious cause of blindness. Second being the chlamydia trachomatis, Onchocerciasis volvulus, pseudomonas aeruginosa, acanthamoeba or loa loa.
B.
Yes, B. Onchocerciasis volvulus is the second leading infectious cause of blindness. Second, onchocerciasis is also called river blindness because people who swim in river caught this disease. Vector of river blindness found near a river. It is common in fishermen. It spreads by consuming freshwater fish. It's spread by snails.
B.
Yes, B is the correct option because the vector that is the black flies, it is found near the rivers and streams. So it is common in those areas of Africa where black flies are common near the river. Third MCQ is onchocerciasis causes severe itching, disfiguring skin conditions, and visual impairment, including permanent blindness. The mode of transmission of river blindness is bite of black flies, fecal root, contaminated fingers, mosquito bite, or sexual contact.
A.
Yes, A is the correct option. Fourth MCQ is onchocerciasis started producing microflora about 12 to 18 months after the initial infection and can produce up to 1500 microflora per day for home maturation, whether for 1 to 5 years, whether for 5 to 10 years, 10 to 15 years, 15 to 20, or 20 to 25 years.
C.
Yes, C is the correct option. Adult worm can live in the nodule for 10 to 15 years and it continue producing microflora for 10 to 15 years. Fifth consequence, the adult form of Onchocerciasis volvulus is mostly confined to the subcutaneous nodule. The black fly ingests microflora from the blood during night, skin during the day, open feces, body tissues not disposed of properly, or tears from the eye, from where it ingests
B.
microflora. Yes, it ingests microflora while biting from the skin during the day. Sixth MCQ is, dying microflora of Onchocerciasis volvulus have been recently discovered to release Wolbachia surface protein that activates toll-like receptors 2 and 4. This bacteria act as a endosymbiont of Onchocerciasis volvulus. Main causative agent of are the Wolbachia is the main causative agent of river blindness. Endoxycycline is given to inhibit growth of the Wolbachia bacteria. It helps in the reproductive cycle of parasite. River blindness morbidity is not related to it.
E.
Wolbachia bacteria is the endosymbiont of the Onchocerciasis volvulus. The worm depends on Onchocerciasis volvulus for its life. When this bacteria will be died by doxycycline, the worm will also die. Seventh MCQ is, river blindness apart from causing ocular manifestations also have many dermatological manifestations. Which among the following is not related to it? Whether lizard skin appearance, leopard skin appearance, secret pepper skin appearance, hanging groin, or pustular skin appearance? Which is
E.
not related? Yes, pustular skin appearance is not the manifestation of the onchocerciasis. Eighth MCQ. River blindness affect millions of people, of which 14.6 million have skin disease, 1.5 million had vision loss, and the gold standard test by which the river blindness can be diagnosed is whether skin snip biopsy for larvae, excision biopsy for skin nodule for adult parasites, or antibody tests, slit leg examination of cornea, examination of blood smear for the presence of the larva, which is a gold standard.
A.
Yes, skin snip biopsy for larva is the gold standard test for all the sicknesses. Ninth MCQ is, for the relief of symptoms caused by the river blindness, ivermectin is given at a dose of 150 microgram per kg to adults to kill microflora in a single dose every 6 months for how much time? Whether for 1 to 5 years, 5 to 10 years, 10 to 15, 15 to 20, or 20 to 25 years.
C.
Yes, C. 10 to 15 years. Ivermectin is given every 6 months uh, for 10 to 15 years for the whole lifespan of the adult worm, or as long as the person has the skin or ocular manifestations. Last MCQ is, For prevention and control of river blindness, different strategies are being used. Which of the following is no more suitable now? Whether mass drug administration by ivermectin, wearing long sleeves and pants, wearing permethrin treated clothes, applying DEET on cosine, or whether insecticide is sprayed by the airplane.
E.
Yes, E is the correct option. Insecticidal spray by the aeroplanes. It is no. It is continue till the 1999. After that, mass drug administration of ivermectin is no practice for prevention and control of the Onchocerciasis. This is the key of the MCQs, and thank you very much for this class.
Thank you very much, Dr. Awais. Very nice presentation. Very well done. And see you next time. Allah Hafiz.
Okay, ma'am. Allah Hafiz. Thank you.